Not necessarily, and that's a great question. We hear a lot about runners having heart problems just because they're highly publicized when that occurs. In actuality, runners have very good cardiovascular health. In certain situations, when we have the number of runners that we do, with 20,000 people participating in the marathon this year, we're more likely to see cardiovascular issues, which is the issues that we'll see is basically an irregular heartbeat, and some runners, endurance athletes, have more irregular heartbeats, but we're not sure of the significance of that. The one thing that Baylor SportsCare is doing this next year is to have a pilot cardiovascular screening program to determine if these runners, the Dallas Running Club in particular, have any of these risk factors. Running has become a very popular sport. The population in general is becoming more active. We're having older runners, which are more likely to have irregular heart rates, or just the incidence of irregular heart rates is going up with the large number of people participating. We see it very rarely overall, though. In fact, there's a study from the American College of Cardiology that found that the risk of sudden death during marathons is only 0.8 per 100,000 participants, which of course makes the risk very low. The last death in the White Rock Marathon was in 1986. Now, these things happen in strange patterns. Even though the incidence is very, very low, sometimes a number of incidents can occur in a short period of time. Overall, the risk, once again, is 0.8 per 100,000. With the increased number of participants that we're having, we're more likely to see these isolated events come together. In any case, knowing that you have Baylor SportsCare there for you to take care of an issue if it does come up is comforting to a lot of the runners. The most common injuries that we actually see in the emergency situations are those due to the weather. With extremes in cold and hot weather, we're going to see more problems with core body temperature going up and down that needs to be corrected. As far as the irregular heart rates, it's a very, very low incidence. Other things that we'll see are blisters, muscles cramps, dehydration, different things that are relatively easy to correct. Most important things to remember are to train appropriately. It is a long race. It's something that needs months and months of planning ahead of time to be sure that your body's ready for it. On that note, we also think that a clearance from your physician is a good idea due to the possibility of an irregular heart rate. We also want to make sure people know to plan for the weather, since that is a very common emergency situation that we encounter with marathons. And finally, enjoy yourself. It's an event that we mean for you to have fun with. And if you feel like you're pushing yourself too far or you feel ill in any way, we recommend being evaluated by the Baylor SportsCare team. There are many participants, and for the most part, people do very well. What we do encourage people is make sure you train appropriately. This isn't just a 5K race, it's a 26.2-mile race, and training is imperative. It's important that they condition themselves well, and they even see their physicians before a race, or if they're planning on running a marathon, to be sure they don't have any of these cardiac risk factors.